Hello everyone, welcome to our presentation. I'm excited to have you here today for episode 14. This is our first slide, so I want to start by introducing what we'll be exploring. We'll dive into some fascinating topics, and I'll give you a quick preview of what's coming up. We'll cover the main points and key insights, all in a concise and engaging way. So let's get started and enjoy the journey together. Now let's consider this scenario. Kate has just undergone a mitral valve replacement, which is a major cardiac surgery. During her post-operative period, she suddenly starts experiencing continuous bleeding from her surgical incision. This situation prompts us to think carefully about the possible causes and appropriate interventions. The key question here is, which pharmaceutical agent should Nurse Isa prepare to administer to help control this bleeding? Among the options, we have protamine sulfate, quinidine sulfate, vitamin C, and Coumadin. It's important to understand the purpose of each medication. For instance, protamine sulfate is used specifically to counteract the effects of heparin, which is an anticoagulant given during surgery to prevent clot formation. If Kate's bleeding is due to residual heparin effects, protamine sulfate would be the appropriate choice. On the other hand, quinidine sulfate is an antiarrhythmic agent, which isn't relevant to bleeding control. Vitamin C plays a role in collagen synthesis and wound healing, but it doesn't directly stop bleeding. And Coumadin, or warfarin, is an anticoagulant, so administering it in a bleeding patient would be counterproductive. So, in this scenario, the most logical and effective choice to manage Kate's sudden post-operative bleeding, assuming it's related to anticoagulant effects, would be protamine sulfate. This emphasizes the importance of understanding the pharmacology behind the medications we administer and how they relate to patient safety and care outcomes. Let's take a closer look at protamine sulfate. This medication plays a crucial role in reversing the effects of heparin, which is often used as an anticoagulant during surgeries or in cases of severe bleeding. When we need to quickly counteract heparin's anticoagulant action, protamine sulfate is our go-to agent. It's derived from fish sperm, which might seem unusual, but it's highly effective. The key point to remember is that protamine sulfate binds to heparin, forming a stable complex that neutralizes its activity. This action helps reduce bleeding risks and allows for safer management of anticoagulation. However, it's important to administer it carefully because, in some cases, it can cause side effects like allergic reactions or even hypotension. Overall, understanding how protamine sulfate works is essential for managing bleeding complications effectively, especially in surgical or emergency settings. It's a prime example of how targeted pharmacological agents can significantly impact patient outcomes. After a mitral valve replacement, patients are typically placed on heparin therapy to prevent the formation of thrombus on the prosthetic valve. This is crucial because the artificial valve can be a site for clot formation, which could lead to serious complications like stroke. However, it's important to monitor these patients closely because if they develop continuous post-operative bleeding, it often indicates that there is excess anticoagulation happening due to the heparin. In other words, the blood is too thinned out, increasing the risk of bleeding. To manage this situation, we use protamine sulfate as an antidote for heparin. It works by reversing the anticoagulant effects of heparin, which helps to control bleeding and stabilize the patient. This is a key concept because it highlights the balance we need to strike between preventing clot formation and avoiding excessive bleeding during post-operative care. Understanding this balance and knowing how to reverse heparin when necessary is fundamental to ensuring patient safety after valve replacement surgery. Let's go through some of the medications that are not appropriate in this bleeding scenario. First, quinidine sulfate. This is an antiarrhythmic drug, which means it helps regulate abnormal heart rhythms. However, it has no role in controlling bleeding or reversing anticoagulation, so it wouldn't be helpful here. Next, vitamin C, while it's essential for overall health, it doesn't have any effect on reversing anticoagulation or bleeding. So, giving vitamin C wouldn't make a difference in this situation. Then we have Coumadin, which is warfarin. It's an anticoagulant, meaning it thins the blood to prevent clots. But if the patient is bleeding, giving more anticoagulant would only worsen the bleeding, not help it. So why not the others? Well, the key is understanding what these medications do and what they don't do. They either don't affect bleeding or would actually make the bleeding worse. This highlights the importance of choosing the right treatment based on the mechanism involved, which is central to managing bleeding complications effectively. All right, let's wrap up with some key points on anticoagulant overdose management. If a patient has a heparin overdose, the antidote we use is protamine sulfate. It's important to remember that protamine binds to heparin, neutralizing its effect quickly. For warfarin or Coumadin overdose, vitamin K is the go-to antidote. It helps reverse the anticoagulant effect by promoting clotting factor synthesis. Here's a nurse exam tip to keep in mind. Understanding these reversal agents is crucial because they can be life-saving in overdose situations. Always assess the patient's bleeding risk and monitor their coagulation parameters closely. Connecting this to the overall theme, managing anticoagulant overdose safely and effectively is a vital part of patient care, and knowing the correct antidotes ensures you're prepared to act swiftly and confidently.